Okay, so this is going to be my Foley catheter insertion video. So first I go to my patient's orders. I'm going to go over here to orders. I'm going to scroll down to check for a Foley catheter. It's an active order for prior to surgery, and we're preparing this patient for surgery. So I've checked my orders. I'm going to check her name, Jane Tripp, and her date of birth. And her medical record number will come later when I check her armband. She has no known allergies. I would check for shellfish and latex allergies. And now I have checked my orders, so I don't need them anymore. I'm going to gather my equipment for this skill. I'm going to need non-sterile gloves, a catheterization tray, hand sanitizer, tape to secure the catheter to the leg of the patient, and a towel or some kind of peri-care equipment. So first, I'm going to perform hand hygiene. I'm going to make sure that the catheterization tray is what I need. Mine doesn't have a paper on it right now, but I would check the paper, make sure that I have all the supplies that I need, and make sure that the bag has not been tampered with. Then I would go, I would identify my patient. So I'm going to check armband over here. What's your name and date of birth? Patient says Jane Tripp and states the correct date of birth. So now I'm going to put on my sterile gloves. Apparently not very well. Okay, and now I'm going to place the patient in the position that I'm going to need them in, so I would take their blankets off. For the this is going to be a female patient with hairy legs. Can you please bend your knees up towards your chest and put your feet together, the bottoms of your feet together, and let your knees fall apart. There we go. Okay. So now I'm going to perform peri-care. Prepare my peri-care here. And this would be the chance to check the meatus. Where's my parts? Okay, so I'm gonna wipe anterior to posterior. And visualize the meatus. Now I can take off my non-sterile gloves. Do hand hygiene. I would lower the side rail if I had one, and I would put the patient in a comfortable working position, which for me would be a little bit higher than he is right now. She is right now. Okay, so now I'm going to prepare my areas. I'm gonna clean the table off. And I'm going to open up my bag and use this as my trash can later on. Usually I place this at the end of the bed, the side rail would be here. Don't squish it. I just need it to sit right there. Okay. So now I would perform hand hygiene again because I touched a lot of stuff. Okay. So I'm going to open up the video over here. I'm going to open up the catheterization tray using sterile technique, not reaching over. And only touching the outside inch of the thing. I would have a bigger work area ideally, so I'm going to be gloving over there. So I'm going to be grabbing the outside part and shiny side down underneath the patient. asking the patient to lift. Okay. Same goes here. Just the very outside edge. And again, ask the patient to lift. Okay. So now I'm going to do sterile gloving. Okay, now I'm going to come and get my fenestrated drape. And I can touch this because my hands are sterile in the gloves. Okay, so now I'm going to open up my cleansing solution and using my tweezers. I'm gonna leave one dry. Okay. I'm going to get rid of that one. I'm going to take this tray out. Oh no, mine is stuck. Normally I wouldn't touch the box, but I can't get it out. Okay. So I'm gonna just place that next to this. I'm going to get out my catheter. Being careful because this is sterile. I am going to lubricate the end, squirting my lubricant in there and keeping it inside the sterile box. Now I'm going to take my sterile saline and I'm going to attach it to the balloon and not inflate it, just keeping everything in the box. Replace this. And now placing it on my sterile field. I'm going to, my left hand is not going to be sterile anymore because I'm going to be touching the patient. Using my solution, I'm going to wipe from anterior to posterior. Only once per cotton ball. And then my last dry cotton ball to get any extra moisture. Now I can discard this. Now I'm going to be taking my dominant hand, getting my lubricated tube, and inserting until I get urine return. I didn't put any stuff on it, so I shouldn't get on your pants. My non-dominant hand, I'm going to hold the catheter, and I'm going to inflate the balloon with 10 ml liquid, so that should not move now. I'm going to take out my bag. Sorry, first I'm going to secure my bag. Oh no.
Never done.
Can you hold it with one hand? Or just hold, grab it. Okay, I'm gonna hang this with no dependent loops. On the side rail of the bed, I'm gonna get my tape. And tape without tension. Female patients, I'm going to tape it just to the leg to hold it. Male patients with the penis facing toward the chest. I'm going to make a little chevron here to hold it. Then I can, I'm going to choose to rip this now. All of this goes into the trash. I'm going to deglove, perform hand hygiene. Place the patient in a lowest position with the side rail up. Make sure the call light is in reach. Ask the patient if they're feeling any discomfort and have them call me if they are. Then I'm going to go back to my charting. I'm going to go to flow sheets. I'm going to go to lines and drains. Going to go to new entry. I'm going to scroll down to urinary catheters, click add. Type is going to be Foley. Action will be insertion. Size would be on my paper on my catheterization tray. Balloon size, I inserted 10 mLs. I inserted it. This is going to be pre-surgery. It's going to be a standard bag because it's hanging from the bed. Urine description would be clear, pale, yellow. Patient response would be tolerated well because he didn't scream. And I could put any additional comments that I wanted. I click save and just check to make